It's Breast Cancer Awareness Month. My name is Dr. Akhtar, and here at ROC we would like to provide you with a guide on how to perform a breast examination so that you can do so with confidence. Early detection of any cancer or disease dramatically improves the outcome and prognosis. An examination of the breast is a simple way of doing this. Unfortunately, most women don't self-examine, and most who do not do it properly. The first stage of any examination is inspection. You should stand in front of a mirror and observe the breast. You're looking for any new asymmetry. A degree of asymmetry is perfectly normal. You want to see if there's any changes in the shape or the contour of the breast. And you want to see if there's any changes to the skin, including the nipple. You may wish to perform some maneuvers to try and elucidate and clarify if there are any changes that aren't visibly apparent in the normal standing position, such as leaning forward or bending to the sides. The next step would be to palpate or feel every bit of breast tissue. The aim here is to compress the tissue between your fingers or between your fingers and against the chest wall to ensure there are no lumps or changes. To make sure no part of the breast is missed, you can either divide the breast into quarters and then approach them individually, or you can work your way in concentric circles from the nipples, working your way outwards. It's important not to miss the anatomical structure known as the tail of Spence, which sits underneath the arm in the armpit. An important part of palpating the breast is to also press and stimulate the nipple. That's to see if there's any lumps underneath or to see if this elicits any discharge. Examination of the breast should always include palpation of the lymph nodes within the axilla or the underarm. This is the place where the immune system first serves the breast and gives us lots of useful information. You should imagine there are 4 walls to examine. Start off by examining the chest wall, push against the rib cage, then the pectoralis, push against the chest muscle at the front, the latissimus dorsi, push against the muscle at the back, and then press along the underarm. You're looking for lumps that would typically feel the size of a pea, hard and rubbery. These are lymph nodes. If they're present, you should seek medical attention. Become familiar with your breasts. Ensure you know your normal anatomy so that you can detect any changes or lumps that arise and then promptly seek medical attention with your doctor. You may notice some changes in feeling some slight lumpiness accompanied by tenderness at certain points in the menstrual cycle, typically the premenstrual phase when the hormones, namely estrogen, are at their peak. These are called fibrocystic changes and are completely normal. They should settle as the month goes through. The breast should be examined monthly. I usually recommend this is done during the first shower of the month for convenience. Make yourself an expert in your own anatomy. That way, when you go to the doctor with a problem, the management plan can be generated with 2 well-informed individuals. If you're experiencing any problems with your breast health, please see your doctor. At ROC Aberdeen, we have a dedicated breast service run by specialists with access to ultrasonography, mammography, and with the capacity to perform biopsies if necessary. In our London branch, we have very experienced doctors working alongside world-leading breast experts. Should you have any queries, please feel free to contact us, where our friendly team will be delighted to help you as best we can.